running sleep labs in actually Los Angeles with Gisu. It was about 18 years ago. And we ran very large sleep labs back then, and we were doing home sleep testing almost 20 years ago. But back then, we took a whole PSG, put it in the patient's living room, ran cables to their bedroom, and we did a full sleep test in the patient's home. We packed everything up in the morning and ran back to the lab, and so it was an effort that was worthy, but it was way, way ahead of its time. Our high-level goal is, if you think about the size of CPAP market. Anybody know what the size of the market is for CPAP? It's, if you add the two big companies together, it's about $7 billion in revenue a year for the devices. Anybody know what oral appliance therapy is? Yes? Less than 30 million. Given a choice, everything equal, do you think people would choose oral appliance therapy or CPAP? Oral appliance therapy, right. So why? What's going on? Why does the lease get 7 billion and oral appliance 31? Okay, so to me there's the opportunity. For all of us in this room, there's the opportunity. Once we fix this gradient that's heavily hooked towards CPAP, and we make it so patients say, well, I'm mild, moderate, and I prefer oral appliance, why can't I get one? So our goal is to fix that. Okay? What if the snoring gets a little better? Is the apnea better or worse? Anybody guess? Better or worse? You don't know, exactly. Okay, so why it could be that you improve the apnea by putting in a snore guard. But it's just as likely that you push the tongue farther back in the airway. And then what do you think happens to apnea when you push the tongue back? It gets worse, that's right. Our point is, take a measurement, no, find out, figure it out. It's not that hard. It's $15 for the supplies, a little bit of your time, and find out. And the thing is, the risk that you offload is tremendous. Okay? Airway issues, okay? This is my way of talking to dentists about sleep apnea with sleep specialists in the room. If I talk about obstructive sleep apnea, the nervousness of the sleep community goes way up. So what I do is I talk about airway, identify an airway issue, and then figure it out. If you say, oh, you know what, you have apnea, I'm a snore guy. You have apnea, sorry, I only do silent nights. Someone do a sleep lab, whatever. But if you know, at least you're managing it. The problem is when you don't know. The inhibitors that would keep you from biting down harder are asleep with you. So this is a lot stronger. Okay, so people can brux much stronger while they're asleep than when they're awake. Okay, that's how the damage, that's why you need to measure when they're asleep. Okay, so it's crazy, all these evaluations that people make with cone beams and pharyngometers and on and on and on. And they come into my office patient and they sit in a chair and they do something to evaluate the airway while the patient's sitting there looking at it. Okay? Well, when the body shifts gear into sleep, all that changes. So all your data points now are great for a waking patient, but the value, does it translate to what the patient's doing while they're asleep? That's the question. I think not, but maybe I'm wrong. It took me about 2 years to figure out that you guys need to make money. Okay, because remember, I've been telling this story for a while, and we've had this conversation many, many times, and the conversation that got this room full was, we have a way now for you guys to make a living at this, okay? So, we're going to go from that to medical billing. And for that, we have somebody that's been doing specifically sleep medical billing since 1862. I mean, for 20 years, at least 20 years. And she's been doing both the testing, billing, and then also the therapeutic part, so the CPAP and oral appliance therapy. Her name is Gisu Amory. She's a personal friend. We've known each other for many, many, many years, and she's gonna, if you guys want to make money, forget about what I said and listen to Gisu, okay?
I've been doing sleep for close to 20-some odd years. Now I have my own sleep app, okay? I have a 2-bed app, which I do the diagnostic testing. It's in Palms Desert. The reason I'm giving you all this background is, I tell you, what you guys will be doing is the best scenario for the patients, both getting them diagnosed and treated versus what I do in a sleep app, okay? Now, what I have known for years is patients who are being diagnosed, they get the machine, the CPAP machine. They probably use it for a couple months, the most a year, and then they're going to stop using it. Okay, so what's going to happen to those patients? Not only they end up paying a whole bunch of money out of pocket, the insurance paid for it, and then they don't get the treatment they need. Okay, and they don't have any idea they can go to their dentist if they're CPAP, BiPAP, or AutoPAP intolerance and get oral appliance to help them with their sleep apnea. They think, okay, it's going to cost them a lot more, their insurance is not going to pay for it, and they don't have the money to just do it, so they forget about it. Now, well, if it's done correctly, yes, the health insurance will pay for it, if all the documentations are there, and that's what you guys come and
Oral appliance therapy isn't going away. If anything, it's probably the biggest growth therapy in sleep apnea world, okay? And you're a required component in that growth. And if us and others are successful at getting oral appliance therapy on par with positive pressure CPAP, remember the pie I talked about earlier? Okay, it's a pie, and right now where this, you can't even detect the sliver that oral appliance therapy is. I mean, it's a little line, and when it's otherwise 99.9% CPAP, positive pressure. If we can get 2, 3, 4, 5%, what's 5% of 8 billion? I don't know. It's a big number though. And
very proud that we'll be able to work with some of the leading truck stops, Roadie's Truck Stops, and internettruckstop.com, which is one of the largest, actually is the largest online trucking stop. And what we've done is we've put together a program teamed with DDME, and the Roadie's Truck Stops, and we call it Vital Signs. Now what Vital Signs is helping the commercial trucker, the professional driver, we're not going to only help them with sleep apnea testing as it comes down with the federal regulations. We're helping them find a dentist because we know the truckers are busy during the day. They don't have time to make dental appointments. This service allows them to call an 800 number or just go online to the website and hook right up to us. So what we're excited to present to you, and remember dentists that we hope you to be with us, that we have an opportunity to not only be able to refer you on a general dentistry level for the local truck drivers in your local areas, but also to provide some expertise because there's another market in there. Every community has truck drivers. And to be able to serve that part of your community, we believe is just a really good idea.
A windfall, and this is going to be a windfall coming into everybody that's involved. The truckers have to do it. It's not a matter of if, it's a matter of when.
Just to tell you a little bit about myself, I've been a general dentist for 38 years. I got involved in sleep because my wife, we discovered had severe sleep apnea. She was CPAP intolerant. Now what? And so that started my process of learning. And as I got into the process of learning, I found out that I had obstructive sleep apnea, moderate obstructive sleep apnea. So both her and I have been wearing appliances for 2.5 years, something like that.